The economics of healthcare: access, cost, and quality. Introduction. Healthcare is one of the most critical sectors of any economy, impacting not only the well-being of individuals but also the overall functioning of society. The economics of healthcare encompass a broad range of issues, from the accessibility of care to its affordability and the quality of services provided. In most countries, healthcare spending represents a significant portion of GDP, with governments, private insurance companies, and individuals bearing the financial burdens. The balance between providing access to quality healthcare services and managing costs is a major challenge for both policymakers and healthcare providers worldwide. In this article, we will explore the complex relationship between healthcare access, cost, and quality, discussing the economic factors at play and how they shape the future of healthcare systems globally. Number 1. Defining healthcare economics. Healthcare economics refers to the study of how healthcare resources are allocated, financed, and consumed. It examines the economic behaviors of individuals, healthcare providers, governments, and insurers within the healthcare sector. The core concerns of healthcare economics include understanding how to efficiently distribute limited resources to meet the population's health needs, the role of competition and market forces in the healthcare industry, and the effect of government policies on health outcomes. As healthcare systems vary greatly from one country to another, the economic principles that guide them differ as well, influenced by factors like government involvement, market dynamics, and social preferences. This section will define healthcare economics, outlining its key principles and how they relate to broader economic theory. Number 2. Healthcare access. Who gets what? Access to healthcare is a fundamental aspect of any healthcare system, and it can vary widely depending on factors such as geography, income, education, and government policies. In many countries, particularly low and middle income nations, a significant portion of the population lacks access to even basic healthcare services, resulting in poor health outcomes and lower life expectancy. On the other hand, in high-income countries, although healthcare services are more readily available, issues of accessibility often arise due to long wait times, the complexity of insurance systems, or socio-economic inequalities. This section will explore the economic factors that influence healthcare access, including the role of government-provided healthcare versus private sector services, and the barriers that prevent equitable access to healthcare. Number 3. The cost of healthcare: rising expenditures. One of the most pressing issues in the economics of healthcare is the rising cost of medical services. Over the past several decades, healthcare costs have been increasing at rates that outpace inflation in many countries, including the United States. These rising costs place a heavy burden on individuals, employers, and governments alike. The reasons for this increase are multifaceted, including the growing demand for healthcare services due to an aging population, advances in medical technology, the high cost of prescription drugs, and administrative inefficiencies in both private and public healthcare systems. This section will discuss the factors driving the rising cost of healthcare, the impact of these costs on different stakeholders, and the economic implications of unchecked spending in the healthcare sector. Number 4. The role of government in healthcare financing. Government spending on healthcare is a major component of national budgets, particularly in countries with universal healthcare systems. Governments typically finance healthcare through taxes, public insurance programs, or social security systems. and they may also regulate prices for medical services to control costs. In countries with private healthcare systems, the government may provide subsidies, tax incentives, or public health insurance programs to ensure that healthcare remains accessible to low-income individuals. The debate over the role of government in healthcare financing centers on how to balance the need for affordable access to care with the sustainability of public finances. This section will analyze the role of the government in healthcare financing, focusing on the different models used around the world. For example, single-payer systems, mixed systems, and private insurance models. Number 5. Private healthcare and insurance systems. In many countries, private healthcare and insurance play a major role in providing access to medical services. Private insurance companies offer individuals and families coverage for medical expenses, and private healthcare providers deliver a range of services, often at a higher cost than public systems. While private healthcare systems can offer faster access to care and more choices, they can also lead to significant disparities in access and quality, with wealthier individuals receiving better care than those who cannot afford it. The economic efficiency of private healthcare is a subject of debate, as the high cost of private insurance premiums and medical treatments can strain household budgets and increase inequality. This section will explore the economic implications of private healthcare and insurance, focusing on the advantages and disadvantages of privatization in healthcare systems. Number 6. The impact of technology on healthcare costs and access. Technological advancements have both positive and negative impacts on the economics of healthcare. On one hand, new medical technologies such as robotic surgeries, diagnostic tools, and telemedicine can improve the quality of care and make it more accessible to patients. On the other hand, these innovations often come with high costs, both for development and for implementation in healthcare settings. Furthermore, the rapid pace of technological change can create challenges for healthcare providers and insurers, who must balance the potential benefits of new technologies with the costs involved. This section will discuss how technology influences healthcare costs and access, examining both the potential for cost savings and the financial challenges posed by new innovations in medicine. Number 7. Quality of healthcare. What does it mean? Quality of healthcare refers to the extent to which healthcare services improve the health outcomes of patients and meet the standards of safety, effectiveness, and patient satisfaction. A high-quality healthcare system ensures that individuals receive timely, appropriate, and effective treatment, and it prioritizes patient-centered care. However, measuring quality is difficult, and it involves a complex set of factors, including patient outcomes, the efficiency of healthcare delivery, and the ability to minimize medical errors. Economic factors such as healthcare spending, workforce training, and access to medical technology all play a role in determining the quality of care. This section will explore how quality is defined and measured in healthcare, examining the factors that contribute to high-quality care and how economic forces shape the provision of healthcare services. Number 8. Healthcare workforce, training and compensation. The healthcare workforce, including doctors, nurses, technicians, and support staff, is essential to delivery of high-quality care. The training and compensation of healthcare workers are central to the economics of healthcare. In many countries, there are shortages of healthcare professionals, particularly in rural or underserved areas, which limits access to care. Furthermore, the compensation of healthcare workers varies significantly between countries and healthcare systems. influencing recruitment and retention rates, the cost of training healthcare workers, the economic incentives for healthcare professionals, and the distribution of the workforce all affect the quality and availability of healthcare services. This section will examine the economic challenges related to the healthcare workforce, focusing on issues such as training, salaries, labor shortages, and the impact on healthcare quality. Number 9. The role of health insurance in healthcare access and cost. Health insurance is a critical component of most healthcare systems, as it helps individuals pay for medical services and protects them from financial hardship due to high healthcare costs. Health insurance can be provided by the government, employers, or purchased privately. The way health insurance is structured can significantly impact access to care, the cost of treatment, and overall healthcare quality. Issues such as insurance premiums, deductibles, and coverage limits can create barriers to access for certain populations, particularly low-income individuals or those with pre-existing conditions. This section will explore the role of health insurance in healthcare systems, focusing on how different insurance models impact the cost, accessibility, and quality of care. Number 10. Universal healthcare systems, pros and cons. Universal healthcare systems in which the government provides healthcare service to all citizens are designed to ensure that every individual has access to care regardless of their ability to pay. These systems are funded through taxes and may include elements of public health insurance, subsidized care, or direct government-provided services. Universal healthcare aims to reduce health disparities and ensure equal access to medical services. However, challenges such as long wait times, underfunding, and inefficiencies can arise, leading to debates about the sustainability and effectiveness of these systems. This section will discuss the pros and cons of universal healthcare systems, exploring how they address healthcare access and cost while considering the challenges they face. Number 11. The economic impact of health crises. Health crises such as pandemics, natural disasters, or outbreaks of infectious diseases can have significant economic implications. These events can strain healthcare systems, disrupt labor markets, and lead to widespread financial losses. The COVID-19 pandemic, for example, highlighted the vulnerability of global economies to health emergencies. The cost of responding to health crises, including healthcare expenditures, public health measures, and economic relief packages, can be astronomical. Moreover, prolonged health crises can hinder economic growth, increase poverty, and exacerbate inequality. This section will examine the economic impact of health crises on both national and global economies, analyzing the costs of managing such events and their long-term consequences. Number 12. The role of preventive healthcare. Preventive healthcare aims to reduce the incidence of disease and improve health outcomes by focusing on proactive measures such as vaccination, screenings, and healthy lifestyle promotion. By preventing illnesses before they occur, preventive care can reduce the need for expensive treatments and hospitalizations, ultimately lowering healthcare costs. In addition, it helps improve the quality of life by preventing chronic conditions that can reduce productivity and increase healthcare spending over time. This section will discuss the economic benefits of preventive healthcare, highlighting the cost savings and health improvements that can result from an emphasis on prevention. Number 13. The economic impact of healthcare inequality. Healthcare inequality occurs when certain groups within a society do not have equal access to quality healthcare services. These disparities can be based on factors such as income, race, geographic location, and education. Economic inequalities in healthcare lead to worse health outcomes for disadvantaged populations, which in turn affect national productivity, social mobility, and overall economic development. Addressing healthcare inequality is critical for achieving equitable economic growth and improving the quality of life for all citizens. This section will explore the economic consequences of healthcare inequality and discuss policies that can help reduce disparities in healthcare access and outcomes. Number 14, conclusion. Balancing access, cost, and quality. In conclusion, the economics of healthcare is a complex and multifaceted issue that requires careful consideration of access, cost, and quality, ensuring that all individuals have access to high-quality healthcare services while managing the costs associated with those services is a challenge for governments, healthcare providers, and insurers. As healthcare systems continue to evolve, it will be crucial to find a balance that prioritizes the well-being of individuals and society while maintaining the financial sustainability of the healthcare sector. Addressing these economic factors will be essential for building healthcare systems that can meet the needs of a growing and aging global population. Conclusion. Healthcare plays a fundamental role in the functioning of any economy, influencing not only the health and well-being of individuals, but also the productivity and economic growth of nations. The economics of healthcare involves a complex balance between access, cost, and quality. Understanding how these factors interact is crucial for policymakers seeking to create systems that provide equitable access to care while controlling costs and maintaining high-quality services. As global healthcare needs evolve, the economic principles governing healthcare systems will continue to shape the future of public health and economic prosperity.